When assessing the knee joint, the therapist will usually start with asking the patient about the injury, any previous injuries and their medical history. This is followed by observing and palpating or feeling the joint for tender areas and changes in tissue tension and temperature. Assessing the length of the surrounding muscle groups usually follows. The quad muscles are tested by bending the knee as far as possible. 120 degrees is a normal range of motion, although this should always be compared to the other side. The hamstrings are tested by lifting the straight leg as high as possible. A normal range of motion for this movement is 80 degrees. Tight muscles can affect the functioning of the joint. The groin and calf muscles may also be assessed. To check muscle function and strength, the therapist may use resisted muscle tests. To test the quad muscles, the therapist resists the patient as they try to straighten the knee. The hamstrings may be tested by the therapist applying resistance as the patient tries to bend the knee. Pain on contracting the muscle, which was not present when the patient relaxed and the therapist moved the limb, indicates a muscular injury. The therapist may move the kneecap from side to side to check its movement and that this does not cause pain. Pain indicates a possible patella injury, patellofemoral pain syndrome, or articular cartilage damage. There are a number of special tests which are specific to the knee joint that can be used to indicate damage to certain structures within the knee. To test the anterior cruciate ligament, the therapist may try to pull the shin bone forwards from underneath the thigh bone. This is known as the anterior draw test and is positive if there is excess movement compared to the uninjured knee. Laxman's test can also be used to test the anterior cruciate ligament. For this test, the knee is only bent to around 30 degrees. To test the posterior cruciate ligament, the therapist may hyperextend or over-straighten the knee. This places stress on the ligament, and so this test may cause pain when a partial rupture of the posterior cruciate ligament is present. Other tests for the posterior cruciate ligament, or PCL, include the posterior draw test, where the therapist applies a backwards pressure to the shin bone. A positive result is if the shin bone moves backwards more than the uninjured side. The posterior sag test involves the therapist raising the leg so the shin bone is horizontal. They then observe for a sagging backwards of the tibia, which is a classic sign of PCL rupture. To test the medial collateral ligament, the therapist would apply an outward pressure to the lower leg, which stresses this ligament. Pain on the inside of the knee or considerable joint gapping is a positive result. Similarly, for the lateral collateral ligament, the therapist will apply an inward pressure to the lower leg. Pain on the outer knee or considerable joint gapping is also a positive sign. Macmurray's test can be used to indicate damage to the meniscus or cartilage in the knee. The knee is bent fully and the therapist applies a force to the knee with one hand and a rotation force to the lower leg with the other. A positive result is recorded if there is pain with an associated pop or click in the joint. Apley's test can be used for assessing the meniscus. With the patient lying face down and the knee bent, the therapist applies a downward force and rotates the shin bone at the same time, trying to trap the meniscus between the shin bone and thigh bones. A positive result is pain and clicking or popping in the joint. In suspected cases of IT band syndrome, the therapist may perform an Ober's test to check tightness in the IT band. In a side-lying position, the therapist takes the upper leg back and then allows the leg to drop down into its natural position. The IT band is considered tight if the leg moves down less than 10 degrees from horizontal. Noble's test may also be performed, where pressure is applied to the IT band on the outer knee as the knee is bent and straightened. Pain is a positive result for IT band syndrome.